All right. Sorry, I forgot that. So, again, good afternoon. My name is Robert Martiniano. I'm the Senior Program Manager at the Center for Health Workforce Studies. And today we're going to go over the data collection tool that we're asking you to use to report your staffing. And as I previously said, this is part of the DSRIP requirements. This is actually year 5 of the DSRIP program, or we're in year 4, and this is a year 5 requirement. And I'll go over why we're starting it now. It is being recorded so that we're going to archive it, and once we pull it off, put it on the archive so you can actually, on our website, so you can actually listen to it again. The structure today is I'm going to do an overview. I'm going to discuss our technical assistance, what we can provide you. I'm going to review the survey instruments. There's actually 2, and I'll explain that. And I'm going to allow time for questions and answers at the end. Now, there aren't that many people, so again, if you have questions, you can either send them through the chat box or unmute your phone and ask them. We're going to be pretty informal. So I just wanted to give a brief overview of the center. We're currently working with 3 other PPSs on their work data collection, and again, this is a requirement in year 5. And we previously worked with SOMOS and a number of other PPSs to collect data in years 1 and years 3. So for those of you who are not familiar with DSRIP PPS, this was a program funded by the federal government through New York State to help redesign the healthcare system, specifically for Medicaid patients, to help more appropriate, use of emergency room, private practices, hospitalizations, etc. As I said, this survey we're doing now is the 3rd one in a series. We did it year 1, year 3, and year 5. And one of the things we will be doing is, when we do the analysis, is to compare what we've seen in each of the 3 years to try to understand if there's any change in either workforce, salaries, things like that. So this survey is a couple of things. We're going to be asking you for the count, how many people you have in what position. We're going to also ask for salary and benefits, and I'll describe what that means a little later. And one of the things we're doing is collecting it, and we have to follow federal antitrust laws, and I will describe that also shortly. We're also going to be asking questions about your training needs and what trainings you've provided. And again, I will go into each of these specifically in our upcoming slides. Okay, so let's start with what we do. We have put the survey and supporting documents on our website, which we've given you access to. You can download those and use them and refer to them as you need. We also provide technical assistance via either email or phone calls, and I've listed Chris Stiegler here, who's going to be the main contact for you at the center. If you have questions, she can answer them, I can answer them. If we have a difficulty answering a question, we will consult together, and then we'll also call SOMOS and make sure that we're giving the right response and a consistent response. So, over the last week or so, you've received several emails from us and from SOMOS indicating both the website and this webinar. You should have received something on the 10th and on the 15th from us. And this email includes a link to our website. And on that is survey and, again, supporting documentation, including frequently asked questions, instructions, a list of the occupations, and a description. There are 2 surveys. One is for medical practices or private practices, and one for everybody else. So if you have a question how you are being defined, please call SOMOS or please call us, and we will help you. And we're going to go through, as I describe these surveys, we'll go through both surveys, so it's not just one or the other. Next. Okay, so let's start with basics. And the first basic is you need to copy the survey to your hard drive or to a zip drive or floppy drive, thumb drive, whatever you call it. If you just open it and try to put in the information, it will not save the information. When you send it to us, it will be blank. And the same thing actually is with a Mac. If you open the survey in preview on a Mac, it won't serve it. Again, save it. Sorry. Again, you need to save it to your hard drive. And
okay.
Could you please mute your line? And as I said, as you save it, you should actually give it a naming convention so that as you send it to us, we know that we can distinguish from one response to another. And this is an example of a naming convention. So SOMOS, 1 Main Street, Elmhurst, 1 Main Street, New York City, whatever, just so we have an understanding of a distinction of who you are. And so as we start compiling them and getting them in, which we'll get 300 to 400 at least, we want to make sure that we don't overwrite existing surveys. One of the things that I will emphasize now and later is that we want a survey for each site you have. So if you have a site at 1 Main Street and you have a site at 1 Elm Street, we want 2 surveys. Additionally, if you provide, and this is more for the non-private practices, if you provide multiple types of services, and I'll describe what that means, at a site we want multiple surveys. So for example, if you're a provider that does home health care and nursing home care, we want 2 surveys that breaks out the staff by those distinctions. Again, this is a non-practice issue. So again, we're asking for at least 1 survey per location or site. If you have 2 sites, two surveys. If you have 2 types of services at a site, then we want 2 or more services. Then we want 1 survey for each facility type. And the facility types are listed on the top of the page. And if you don't know your facility type, you can either call SOMOS or us, and we will work with you to appropriately define who you are. Okay, so let's start by looking at the first survey, the general survey. So as you can see, this is going to be required information. It's asking you to describe who you are, your address, the contact and email information, your NPI and your Medicaid number if you have them. If not, leave them blank. And what other PPSs, if you know, if you're working with. Okay. Again, required fields, the PPSs. So as you can see, type of facility is actually a drop-down menu on this survey, and it's going to ask you, are you a hospital, are you a nursing home, are you a federally qualified health center, whatnot. So again, if you have a question, or are you a community-based organization, a social services organization. So again, just use that to describe your organization. So again, if you have questions, please let us know. Okay, so the bottom 2 questions are going to be based on how you organize and pay your staff and the hours your staff works. So if you define 40 hours or 37.5 hours or 35 hours for everybody who works for you, then you can just click on, says full-time hours, hit same for everybody, hit yes, and it's going to ask you to specify and you put in those hours. And if you hit no, then it's going to ask you in the body of the survey. The same is for fringe benefit rate, and I'll describe what that is. If your fringe benefit rate is the same no matter whether you're an administrator, a clinician, support staff, 28%, 30%, whatever, then just click yes, put in the fringe rate, and you don't have to put it in anymore. And again, if it's different by different occupations, which some have based on unions or other compensation packages, then we will ask you to fill it in the body of the survey. Just an FYI for the fringe rate, it's actually 2 decimals, so it could be 28.57 or something like that. So this is just an example of the medical practice survey. So if you're a private practice, regardless of your specialty, primary care, mental health, gastroenterology, whatever, you use this. And the same thing applies in terms of your contact information and the PPSs that are involved. There is somewhat of a difference when it comes down to this page. Again, the facility type, you're going to hit the type of facility you are. Again, it will be private practice. We're going to ask you what your PCMH is, your primary care medical home designation is. So if you know that, please fill that in. Total number of staff we're asking for, your fringe rate, your full-time hours. And for here, we're asking you if you're a collective bargaining unit. And again, that's mostly for if any of your staff are covered by collective or bargaining agreements or covered under your union. So that's just a yes or no question. So if even one person is covered, hit yes, otherwise hit no. And then the last thing you're going to see is office hours. Please indicate what your office hours for each of the days are. Okay. So I'm going to take a deep breath and wondering if anybody has any questions. So again, either through the chat box or through opening up your phone lines and just shouting out your questions. Okay, so let's go next. Okay, so we're asking you to fill out your data as of June 30th, 2019. And we're doing that for a reason. And the reason is essentially the antitrust rules. That we can't report data if it's less than 90 days old. So by the time we report that, sometime in October, it will be more than 90 days old. We can only report it in the aggregate. And if we get a response in an occupation that less than 5 organizations respond, we can report the counts, like how many counts, how many FTEs, whatnot, but we cannot report the salary and compensation information. So we do have limits. And the final antitrust thing is it's got to be collected by a third party, which we are. So we don't share the raw data with SOMOS. We collect it. We will put it together for them. We will summarize them in a report we give to them, but there'll be no indication who responded to what. And again, all the information is in the aggregate. Again, I've just kind of repeated all this. So it's got to be 90 days old, cell size issues, and third-party collection. So again, what we're trying to help SOMOS understand and the state understand, were there changes in workforce based on the changes based on DSRIP programs? Okay. And just for compensation and benefits, as you think about comp and benefits, you're thinking about your base rate, your cost of living, your longevity pay. Do not consider on-call, if you get paid for on-call time, which some hospitals will do. You'll get a $2 or $3, I know at least upstate they do $2 or $3 while you're on call, even if you don't get called in. So it's your base rate, whatever cost of living adjustment you may have gotten for the year, whatever longevity adjustment you may have gotten for the year. We don't want overtime. We don't want, again, we don't want overtime. We don't want, on-call pay, things like that. So just think about your base pay. Okay. Okay, so on both the general survey and the medical practice survey, we're going to ask for a number of things in terms of your staff, your number of staff, your FTEs, and the number of vacancies. So the number of staff basically is how many bodies do I have, regardless of whether they're working full or part-time. So I may have 4 people, but only 2 people are working full-time and 2 people are working part-time, but you're still counting them as 4. The FTE gets to the question of how many hours are you working. So couple things. That's based on what you consider full-time. So if full-time is considered 40 hours and somebody's only working 20, then they're considered a 0.5 FTE. If full-time is considered 35 hours and they're working, I'm going to do the math in my head, they're working 22 and a half hours, then they're considered 60% or 0.6 FTE. So again, FTEs are going to be based on the number of hours a person works compared to what you consider full-time for that position. So full-time for nurses may be different than full-time for administrators. You're going to want to calculate the FTEs different. And you're also going to want to indicate what you consider full-time for those people. We're also asking for the number of vacancies. And so some organizations will have positions on the book that they have no intention to hire for. What we're looking for are real vacancies that you're in the process of recruiting for, or you have anticipation you're going to be recruiting for shortly. So again, if you've got 10 nursing positions, you've got 8 bodies in them, and you're looking to fill 2 bodies, then you've got 2 vacancies. So again, please think about that. We're looking for true positions that are vacant, not necessarily those that are vacant on the book, but either there's no money attached to them or for whatever other reason you're not planning to fill them. So as I said a number of slides earlier, if full-time is based on individual occupations rather than the organization as a whole, we want you to indicate it here. So again, it may be 40 hours for administrators, it may be 37 and a half for PT and OT, and maybe 35 or 36 for nurses, depending on their schedule. So again, if full-time is defined for everybody, you fill it out on the first page. If it's different depending on an occupation, you fill it out on this page. And that's the same with the fringe rate. If fringe rate differs, again, especially for hospitals and other facilities, they may have different people unionized by different organizations, or may have fringe rates differently for different people, different occupations. So you're going to want to indicate per occupation what that fringe rate is. Again, these are mostly for organizations like hospitals, nursing homes, home health care. Private practices generally don't do that. And the last question, again, is CBA. Is anybody in that occupation covered by a union or collective bargaining agreement? I want to go back to fringe rate for just a second. So when we've done this in the past, people have asked what fringe rate is and how it's calculated. So it's any amount of money that's put toward benefits for an employee. And those benefits can be mandatory, like FICA or workman's comp, what you paid into Medicaid and Medicare if you take it out of their salary. Also optional things like health insurance, retirement contributions, life insurance. So as you're looking at your fringe benefits, think about what you're considering fringe for your organization and whether these categories are relevant. And again, that's something we can help you with. So, and as you calculate the rate, you're calculating it based on total salary and what the fringe amount is. So, for example, if I have 4 nurses, they're making an average of $50,000 a year for $200,000. If the fringe rate combined for that is $50,000, then your fringe rate is 25%. So again, if you have problems calculating that, just let me know and let us know here, and we can help you with that. So just some other information we're requesting for medical practices, what the number of people who are over 50 in an occupation, and whether they're female, male, or other. Okay, I'm going to again take us small break to see if anybody has a question either in the chat box or through the phone line.
I have a question in regards going back to the fringe benefit rate.
Sure.
So our practice only has one receptionist and the doctor itself. It's just a solo practice,
Okay.
a private practice.
Yep.
How would that go about to putting in the fringe benefit rate? There's only 2 staff people, basically.
Yeah, so, and my guess is they're probably being reimbursed differently in terms of fringe. So what you're going to have to do is just indicate what you, to the best of your ability, what the fringe rate is separately for each of the physician as well as the receptionist. That's not a problem. So actually, I think I can actually answer that question coming up because we're going to actually ask you for each occupation to fill out a different line. Any other questions before I move on?
No. As of now, everything is good. Thank you.
You're welcome. So any other questions from anybody else, either in the chat box or online or on the phone? Okay. So let's go to how to actually fill out the information. So there's about 100 plus occupations on each of the surveys, but you only have to indicate information for the people you have. So if you notice in this example, and it's a physician, it says primary care, there's a little box to the left of the title that has a check in it. So if you check that box, that whole line is lit up, highlighted, and you just fill out that information. So for the previous question, you've got a receptionist and a physician. You click on primary care if it's a primary care office. You fill out the information, and then you go find where the reception is, which is probably 3/4 of the way down, I believe, under support staff, and you'll see receptionist or office staff, however we defined it. And just click on that, and that's all you have to do. Those 2 people, you save it and you mail it in or email it in. So again, as you look at the occupations you have, you just have to answer for those you have. So I have RNs, I have LPNs, I have physicians, I have secretarial support or support staff, whatever, and you can just fill those in as you need and don't have to worry about anything else. So again, if you're in a practice where the fringe is different for the physician versus the practice administrator versus the support staff and the nurses, fill fringe in at each of those lines separately. If by chance you indicated, or let's say everybody gets the same fringe rate and you indicated it in the opening screen, then you don't have to indicate it here. It actually won't allow you to. Okay, next. So jobs are organized into categories. So we have all the physicians together, we have nurses together, we have support staff together, allied health. So as you go through, you'll see how you're organized. Now, one of the things that is on the website is a list of job descriptions. So not everybody uses the same job description, but you may find as you read them, they're similar. So for example, when we did this the first year, someone said, I don't have psychiatric techs, and again, this is more for a hospital, but I have behavioral health techs. When they read the description, it was pretty similar, so they called them psych techs. So again, if you don't see a description that makes sense, look it up and see who's close. If by chance, couple ways, and if you can't find it, a couple of things you can do. We do add in category for others, so you can put in others, or you can call us and say, we've got, this title, what do you think? Should it be an other, or is there a better description for it? We can help you with that. But again, that online job description will help you understand whether it's something that you call it differently, but it really is a title we've identified, or whether it's not there at all. Okay. So I called this physician issues, but I actually got a question about this in general. So about non-physician positions. So how do you count people who are consultants and come in? So the answer is you only count those people that are on your payroll that either through a they're direct employees or through a contract directly with somebody. If that person comes in and is employed by somebody else, that organization should be reporting that person. So again, if it's a direct employee, and again, this is more for hospitals and some nursing homes who bring in OTs, even some private practice may be bringing in somebody. If they're coming in, they're doing the work, they're billing for the work, they should be reporting themselves, not you. If you're paying them, you're billing for their services, you should be reporting them. And again, this is a question that if you have any questions about, if this is an issue you have questions about, you can please contact us. So, over the last 5 or 6 years, there's been, let me stop here. Does anybody have any questions about contracted or employees? Sir, I move on. Okay. All right. So let's go to the next thing. And again, you can, if you think about it at the end, I'm going to leave time for questions, so you can always ask again. Okay. So over the last 5 or 6 years, and especially as part of DSRIP, we started looking at things called emerging titles. Those jobs that are helping coordinate patient care. And we know from our experience that not everybody uses them the same way. Not everybody has the same qualifications for them. So we're asking for those titles to please give us a little bit of information, such as what experience you're requiring, what degree you're requiring. And again, if you have that title, click it and it'll highlight it, and you have to fill in, you know, the salary, the numbers, etc., and then also this additional information. And those titles include patient care navigators, case managers, care managers, case coordinators, whatever, community health workers. So again, if you think about these titles, where do they belong? And again, there is description on our website and in that document to help you understand those positions. Okay. Now this is specific for medical practices only. And we know that especially in small medical practices, people do multiple jobs. So we're trying to understand in those cases who's doing what. So if you're a medical practice and your provider or your support staff do multiple things, let us know what they do. And this is really to help SOMOS understand the breadth of what all you do and how they may be able to support you going forward. Okay, next, please. Okay. So again, as in the past, and both the employee functions and this training we've asked in the past, you know, what training are you doing? Do you need training? If you're not offering it, are you requiring it? Things like that. Just so again, so SOMOS understands what they could help you with going forward. And this is both for medical practices and for other organization types. Okay. Okay, so finally, survey submission. So as I said, the date of the data is June 30th. We would like submissions no later than August 30th, which is a Friday. You can submit the survey versus email. So once you've saved a computer, you've filled it out, you've saved it again. One thing, once you filled it out and saved it, close it, I would actually open it back up to make sure that it saved the information. Then you can actually attach it to an email. And you can send the email to surveys@chwsny.org. You can also call us or send questions if you have on your survey through that email. And again, either Chris or I will get back to you, or one of my other staff will get back to you. And again, it's just a matter of attaching the email, attaching the PDF to an email and just sending it to us. And I didn't explain that before. This is actually a fillable PDF. So when you open it, you can just fill it in, save it. Again, save it to your hard drive first, open it, fill it in, save it, attach it, and you're good to go. If you have questions with that, that's something we can help you with. Some people may have problems because, and I know even computers here, that you don't necessarily have the ability to save things. So just let us know if that's an issue and how we can get around that. Again, it may be just saving it to a thumb drive or something else that's not on your hard drive. Okay. All right. So general questions. So again, we're not going to take the full hour, and I know this is many people's on lunch break, but we thought because of private practice it would be easier to do now and not interfere with patient care. So again, questions either through the chat box or over the phone.
Okay. I have a question in regards of the surveys. So you were explaining the general one and the medical one.
Correct.
So this goes just based on, like I was telling before, it's just based on 2 staff, which is myself, the receptionist, and the doctor. Should we be filling out the medical practice
Correct.
one?
Anybody who's a private practice should just fill out the even a private practice should be filling out the medical practice one.
Okay.
And it doesn't matter what specialty. So primary care, specialty care, mental health doesn't matter. Psychiatrist doesn't matter.
Okay. Now I have another one, a question in regards to the medical practice one. For they say their PCMH recognition level. What do you mean by that?
I'm going to admit something. I've been doing this for years, and I can't remember what CMH stands for. It's primary care medical home. Sally, remind me.
It's patient-centered medical home.
Thank you. Okay, patients. Yes, thank you. I'm sorry.
Okay, all right.
I remember that. So yeah, patient-centered medical home. So if you've been working with SOMOS or somebody else to get that designation, just indicate that.
Oh, okay. All right. And so if in case if they don't, neither the staff or the doctor herself do that, do we just put not applicable?
Yes, or don't, I forget what the response is, but yeah, just fill it in. So,
okay.
I can't remember, is it a yes-no question?
No, there's actually a drop box that says PCMH level 1, 2, 3.
So, yeah. I don't have the survey up right now, but yeah, if there's an issue with that, let me know. But I think either leaving it blank is fine, or if there's not applicable, type it, select not applicable.
Okay, all right.
Question.
Sure.
I have a quick question. It's an outside biller, and we have not employed by us.
Can you? You're fading in and out. Can you either send it to the chat box or?
I said we have an outside biller that is contracted to do our billing, but it's not a staff. So how do we capture that activity? Because he's paid a percentage of his billings of the claims.
Oh yeah, we had that come up before. Estimate what you consider the FTE would be. Yeah, that came up. I remember that came up last time we surveyed. So if you think that full time might be, I don't know, 1,000 claims a year, and he's doing 250 a year site, figure at 25, 0.25 FTE. But again, if you have questions, more specific questions, you can call us or email us. Again, I forgot about that. That did come up last time. So.
Okay.
Again, please, if you're not asking questions, please try to mute some background noise coming through. Thank you. Other questions? Okay. Anything in the chat box? Nope. All right. So I'm going to give you back 20 minutes to your lunch hour. I want to thank everybody for joining us. If you have specific questions, you can still call or email us. That's what we're here to help you with. We will, in the next couple of days, we will edit this, try to screen out my ums and hesitations, and put it on the website so people can re-listen. Thank you again for joining us, and please let us know if you have any questions. Thank you. Have a good day, everybody.
Thank you. Bye-bye.
Bye.